Hey folks, Dr. Sean Bryant here, back again with E3 Chiropractic and Wellness, and we are continuing our video series here on common running injuries. This week, we're going to be talking about something called patellofemoral pain syndrome, or what is typically referred to as runner's knee. Now, runner's knee or patellofemoral pain syndrome is one of the most common causes for knee pain in the adult population, and it actually does affect 25% of the running population as well. Now, the pain that's experienced typically with runner's knee is described as a dull, painful irritation of the cartilage directly behind our kneecap. So if we start to feel that dull irritation right behind our kneecap during or after our runs, kind of an indicator that we might have this going on. So this condition is typically aggravated by prolonged walking, prolonged running, jumping, stair climbing, even arising from a seated position can kind of make this angry. Typically, the pain is most notable if we're out for a run and we're running on a downhill surface, or if we're starting to go downstairs. That's when we can really place a lot of the stress on that knee and we really notice that irritation. Now, despite the fact that researchers have spent many years kind of trying to define what the exact cause of patellofemoral pain syndrome is, figuring out what exactly causes it has been a little bit of a struggle. However, some recent studies have demonstrated that the most likely cause for patellofemoral pain syndrome while we run is actually due to an abnormal motion of our femur and internal rotating and kind of diving in and jamming up against our very stable patella or kneecap. So when we have that abnormal motion and we're running and we have that hip cave in, the femur kind of comes inside and jams into our kneecap here, and that's most likely attributable to hip weakness, more specifically our hip abduction stability. So our ability of our lateral muscles on our glutes to control the impact as we kind of go down. So an exercise that we can try to kind of combat this patellofemoral pain syndrome is something that I like to call hip abduction wall presses, or otherwise known as the stanky leg. So this would be performed up against a wall. Again, I'm going to be doing it on a squat rack where I stand about shoulder right up against the wall. I slightly hip hinge into this position here where my knees are a little bit bent. I lift up the inside leg and I press this knee up against the wall and I start to press hard. You'll start to feel this on the lateral aspect of this hip, and with this stance leg, you're going to shift out and in and back and forth, and you'll start to feel it on that outside as well. Again, if you didn't get a good angle, you start to come from here, little hip hinge, we come on up, we press this leg into the wall, and then we start to drive the knee out and in, and we're controlling that motion of the femur in relation to our patella. Another big piece to managing this is kind of managing the inflexibility of our quadricep muscles. So making sure we take time to stretch out our quad muscles before and after we go for our runs can greatly reduce the amount of impact kind of on that cartilage in the knees. In the meantime, if you don't want to reduce any of the frequency or the amount that you're going to run this spring, and you want to kind of combat this condition while you still have it, try shortening up your stride length a little bit, speeding up your cadence, and trying to strike the ground with the midfoot as opposed to the forefoot or the back foot. Give this a shot. Hopefully this helps.